Just 5 years after the world was thrown into chaos by the COVID-19 pandemic, another viral outbreak is making waves. According to reports, China has been battling an outbreak of human metapneumovirus or HMPV. While social media is flooded with alarming reports of overwhelmed hospitals and rising fatalities, there's still uncertainty about the full scale of the crisis. So what exactly is happening? Is HMPV as dangerous as it seems? Let's break it down and separate the fact from the fear in today's deep dive. As we look back, we remember the outbreak of COVID-19 that started in Wuhan. Fast forward to today, and there is a resurgence of viral infections in China, with a surge in cases of a virus that may sound unfamiliar to many. But what exactly is HMPV and why is it causing such concern? Let's break it down. HMPV is an RNA virus belonging to the Metapneumovirus genus within the pneumonia virate family. First identified by the Dutch researchers in 2001, HMPV was discovered while studying samples from the children experiencing respiratory infections. Research indicates that this virus has circulated for at least 6 decades and is now recognized as a prevalent respiratory pathogen globally. The symptoms of HMPV are very similar to the common cold and even COVID-19. Cough, fever, fatigue, and other cold-like symptoms. In some cases, it can lead to more severe respiratory issues, especially in vulnerable populations. Now you may ask, how does this spread? HMPV spreads primarily through respiratory droplets expelled during coughing and sneezing. Transmission can also occur through close contact with the infected individuals or exposure to the contaminated environment. The Chinese CDC website states that the infection period for HMPV is 3 to 5 days. Unfortunately, the immune response triggered by HMPV is insufficient to prevent reinfection. While HMPV can be detected year-round, it is more prevalent during the winter and spring months. Now you may ask how to prevent this infection. Wash hands with soap whenever you come home. Avoid touching eyes, nose or mouth with unwashed hands. Maintain the distance with the infected people. People should cover their hands and mouth while sneezing. Avoid sharing cups and eating utensils with those infected. Stay at home when sick. These are some of the precautions that our experts have suggested. If we talk about the social media posts and reports from China, they show that the hospitals are being overwhelmed by patients, particularly children, many of whom are suffering from pneumonia. This has sparked comparisons to the early days of the COVID-19 pandemic. Chinese health authorities are on high alert. The country is monitoring the situation closely, implementing a surveillance system to track the unknown types of pneumonia, a move that echoes the lessons learned from the early COVID-19 outbreak. Children and the elderly are the most vulnerable to HMPV. Now, many hospitals are also reporting a surge in pneumonia cases, with some severe cases resembling the dreaded white lung seen during the COVID-19 pandemic. Though HMPV has been circulating globally for some time, its current surge in China is raising alarms. With lockdowns easing and social interactions returning to normal, a catch-up effect is causing an uptick in respiratory diseases as people are now encountering viruses they have not been exposed to for years. One concerning aspect of HMPV is that there is no vaccine available yet. Despite its similarity to the common cold, this leaves a vulnerable population unprotected against the virus. As the situation continues to unfold, it's important to stay informed. Experts recommend practicing good hygiene, wearing masks, and avoiding large crowds, especially in the high-risk seasons like winter and spring. So stay safe and stay informed, and remember, the fight against respiratory virus is a shared responsibility. Let's protect ourselves and each other. With that, it's a wrap. For more such updates, keep watching moneycontrol.com and please like, share and subscribe to Money Control's YouTube channel.